Assalamu alaikum. Welcome everyone to our webinar, Innovation for a High Value Health System. I'm Fatemah Saif, Knowledge Manager at Value and Health Center, Saudi Arabia's health policy think tank for better value health and care. Today we are exploring an intersection between two critical topics for better health system value, innovation and artificial intelligence. We will be exploring these issues in the context of one specific example of clinical technology innovation. I am joined by two visionary leaders for this discussion, Dr. Reem Bunyan, CEO of the Center for Value and Health, and Prof. Selwa Al-Hazzaa, founder and CEO of SEDM. Greetings to you both, doctors.
Thank you.
Dr. Reem, hi. Dr. Reem, let's start with the big picture and your position in the health system. We hear a lot about AI, new technologies, and of course, value. How do new technologies align with value-based healthcare framework in Saudi Arabia?
Assalamu alaikum, and I'm delighted to be here today, especially with our esteemed guest, Professor Selwa. So delighted to be in this conversation with you. I'm glad, Fatma, you're starting us with the big picture. Because that's always our North Star, and it's always the place for us to start, is to think about what we are trying to achieve through the health sector transformation strategy. We know that we are in the midst of a massive and impressive transformation of our health sector. That is one of a kind globally, that addresses a shift in focus to improving the health and the healthcare for our population. So it's a shift from sick care to healthcare, and it's a shift in the traditional focus of health sectors. And value in health is one of the pillars of this transformation. What do we mean by value? We mean realizing the best possible outcomes, and not any outcomes, but outcomes that matter the most to our population in relation to the resources that we utilize to realize those outcomes. In this fundamental paradigm shift, it makes us start to think more about areas that are traditionally not considered in the prime place of conversations, which is prevention and early detection. Because naturally, if you prevent an illness or if you detect it early, you will realize a better outcome, a better experience for the individual, and naturally less investment and less resources that are needed to realize those. And that is one of the key and exciting elements of our conversation today with Prof. Selwa.
That's perfect. Thank you, Dr. Reem. Prof. Selwa, within Saudi Arabia's shift toward value-based healthcare under the Vision 2030, could you describe the SEDM solution and explain how it is contributing to measurable clinical outcomes, cost efficiency, and patient-centered care, and where it is currently making tangible impact?
Bismillah ar-Rahman ar-Rahim, wassalatu wassalam ala Sayyid al-Mursaleen. Thank you, Dr. Reem, Fatemah, for including me with our solution, because it is a real world, and we are there actually practicing this value-based healthcare. This is really very important. Now, we know that the health transformation of 2030 has shifted from a value-based. Before, as physicians, it was always number. The more numbers you had, it was better. Now we are shifting from this volume-based to actually a value-based healthcare. This is really very important. In our solution that we have here in SEDM, We measure many outcomes, if you will. We're measuring the patient's outcome, the cost efficiency. This is really very important. The integration between the different care deliveries. We'd like to have it as a mass rather than a doctor patient to doctor one-to-one, and also the digital infrastructure. And we're very lucky being in this time and in this era in the Kingdom of Saudi Arabia, because everything now, fortunately, is digital. So tech at the moment, it's not optional in this shift. It's actually the primary enabler. It's not a luxury, it's mandatory. So SEDM solution really aligns with this value-based healthcare, if we will. Why? It's a structured AI-supported clinical data capturing that takes images of the patients. We have standardized documentation, which is also very important, longitudinal tracking of the patient outcomes. What's the importance of having this in our SEDM solution? The importance is we can monitor the visual health improvement. This is really very important. We can track, like right now we're doing diabetic retinopathy, or I'll make it easier, diabetic eye disease. We can actually track the disease progression. We can benchmark across the different providers. This really, what are we doing? We are transforming an episodic visit, being reactive, to an actually measurable outcome where we are proactive. So we have early detection, which is really very important. This is very important for saving the Riyadh. We identify the high-risk patients, we reduce the late-stage complications, and this solution actually does this, and we actually prevent the surgical outcomes. We are interoperable. This is really very important with the other HIS systems. So in large entities such as the ATS and the VIDIA, we can actually integrate. And once we integrate our solution with the system that's already existing, this is really very important because the flow is seamless. There's no duplication. We have a multidisciplinary, and most important, we have it at a population level. And this is very important, of course. Why? Because for the cluster-based healthcare system, now that we have cluster, we're actually working with cluster one at the moment right now. So we are going, I don't look at ourselves, people look at us as a technology vendor. I say no. We are actually becoming a value enabling partner. Why? Within the value-based healthcare transformation. So you mentioned where are we located at the moment right now? We are actually running where we have the impact in 14 different sites. We start from Tabarjal to Rafha, to Al-Madina, Jeddah, Mecca, Hayil, Al-Dammam. We go down to the south, we're in Al-Baha. I mean, you name it. It's just we're in Baha, we're actually in Jazan, then we go to Al Qasim area, also we're there, and in Riyadh. So yes, technically, this AI-enabled ophthalmology platform really sits at the intersection of clinical excellence, digital transformation, health economics, and population health.
MashaAllah. That integration sounds seamless, but I imagine it wasn't easy. Can you tell us, Dr. Prof. Selwa, what were the primary clinical, regulatory, and organizational challenges you encountered when integrating an AI-driven model into healthcare delivery? And how did you navigate resistance, governance requirements, and workflow adaptation to ensure successful adoption?
Fatemah, I would need hours to be able to tell you the challenges, but I will really summarize our last 6 years of challenges. I'll summarize it in 3 minutes. When we integrated Sadia is our solution. SEDM is the company, Sadia is the solution. Why is it called Sadia? Saudi Advanced Automated Retinal Image Analysis. So when we took the first 5 letters, it became Sadia, min al-Yasri. I thought that was really very important. When we went into the healthcare delivery, we approached it through a value-based healthcare lens. That's the way we started, meaning SEDM focus was never just on introducing AI. We weren't just interested in introducing AI, but we wanted to improve the patient outcome. This was really very important. The challenges, and I'll do them quickly. Clinically, I'm a physician, and I've been a physician now, I can't believe it, for 41 years. So the primary challenge was really building trust. You know, physicians, we as physicians are trained to rely on validated evidence, clinical judgment. Introducing AI into the diagnostic pathway really raised a lot of concerns between the physicians. I have to be honest, maybe they were our biggest challenge. They were worried about accuracy, false positives, medical legal, who's going to get blamed if something goes wrong. And the most important thing is they did not want to change their clinical autonomy. To bring in AI would really disrupt them. So we did this by doing clinical validations. We did this by actually we conducted, I can't tell you the number of proof of concepts and the prospect trials we've done. Our publications were there. And most important thing, we told them, this is really very important, both, you know, Dr. Reem and Fatemah, we told them that the AI or SARIA is a decision support tool. This will never replace you. This will augment your work. And this was really very, very important to bring that. Our second, if you will, challenge was the regulation. That was, my God, I will be honest with you, it took us forever and ever, but we were able to finally get it in. Why? Because SARIA is a software as a medical device. We have to remember that. And so we had to meet stringent quality assessment, cybersecurity, data protection. And by the way, we have that in our if you will, in our company. This is really very important. We established a compliant quality management system where now we have the ISO 13485. This is like one of the most difficult to get. We maintain traceability. This was the algorithm updates. We ensured that we were transparent, that we were audible. You know, this was not a black box. I hate to call the AI a black box. I call it a white box, maybe because as physicians, we wear white. This was really very important. And we aligned on the risk management. So technically, the challenge was governance, accountability, transparency, safety. We were able, thanks to the regulators, they really helped us in that. So every member, if you will, of our team really has to incorporate privacy, ethics, data management in every single day. We don't wait for the audits to come to us. We do that on our daily production. And last but not least was really the operational and the mindset. So when you look at the operational, we had to involve the clinicians early. We had to let them know you are the champions. AI is not the champion, you are. And this was really very important because we had to change the workflow and we had to change the mindset. Technically speaking, we were able to navigate the challenge by really positioning SARIA as a value generator and not as a vendor or a device that was sitting there. This really helped a lot. It helped in reducing avoidable blindness and reducing costs and shortening the waiting times, which was killing, it was a bottleneck, improving the access, and most important, we optimize the specialist time rather than him screening and triaging, which a white box can do. We actually had him concentrate more, if you will, on the surgery. So I think having these three variables or these three measurable outcomes, that was really good. We were able to do it. I can tell you, and I'm happy to say this, that we were the first at that time startup that we were awarded by Sadaya, that we complied with data management ethics, and we actually got an award for it and for governance. So I'm happy to sit here and say, yes, the regulations, the operation is a daily networking in our daily production.
That's great, Dr. Selwa. As you said, you are a physician. So from a health system perspective, How can improving early access and patient journey efficiency through SEDAM's diagnostic solution reduce avoidable complications and generate long-term value under a value-based healthcare model?
Right. I think when from the beginning, we were already aware of the value-based healthcare perspective. We had that actually embodied in everything we did. So we were able to improve the patient journey, and this was really very important, by simplifying it, accelerating it, and the personalized care. Each patient that came, it was him, it wasn't anyone, while also ensuring that the outcomes were really the central for the patient. So from an access level, SADIA decentralized screening. We moved it out of the hospitals, and we were able to actually take it to the primary cares. We were able to take it to the charity centers. We were able to take it to the diabetic centers, moving it away from the hospital so that patients did not have to wait for months. Before, patients would have to wait months. Can you imagine at the moment right now, if someone in Tabarjal, look at that, or someone in Jazan, or someone in Jeddah, or someone in Dammam, they don't need an appointment. They actually walk in and they're able to be examined for their diabetic eye disease without ever making an appointment, without ever having to jump on a plane or come to that. So it was really very important to reduce this geographic, if you will, and logistic barriers, especially for the elderly. And if you notice, most of our patients were elderly, so everyone had access. So what's our motto in SEDAM? Democratize healthcare. A VIP will be that gets the care, also the underprivileged in the rural areas. So this was at the access level. At the diagnostic level, oh my God, they love us. They love us because it's quick, it's rapid, they can just walk in whatever district they're in. They don't have to travel. And the most important thing, they weren't dependent on appointments. This was the bottleneck for the initial triad. And all the high risk cases, we were able to flag them. Those cases got referred to the hospitals. So the only cases that got referred to the hospitals were actually the high risk patient. And this actually lowered down the low risk patients did not have to go to the hospitals. They would stay in this district. This reduced delay. It minimized the anxiety that you see in the older people with travel and taking their children or loved ones out of work. And also it optimized the specialist capacity. So we were working on two. We were pleasing and convenient to the patient, and we were also convenient to the doctor. Now in the follow-up, this was really very important because in the follow-up, you have sort of the longitudinal care. So what did SADIA do? We were able to do structured monitoring. And because the system is digital, this was real and traceable, we were able to compare over time. So when he comes in the beginning, we were able to trace from that because it's all done by AI. We improved the community care. By the way, we actually did this a lot in the community, not only in the primary care. So we were able to move the patients from reactive treatment to proactive disease management, which was really essential for the chronic diseases like the diabetic eye disease. So in reality, SADIA shifted the model from a volume-driven episodic care like one time to an outcome-driven population health management. We had timely access, clarity, safety, and most important, and this is important to everyone, we preserved vision. We saved the vision of, at the moment right now, we have done over 40,000 free exams in all the areas, whether it's the Ministry of Health or the charity centers, improving system efficiency and sustainability. This, and in conclusion, really it aligns between the patient level benefit, the system level value, and that was the core of our impact, always wearing the lens of the value-based healthcare framework.
Thank you, Dr. Selwa. That's interesting. You have highlighted critical points that support our focus, which is value. Back to you, Dr. Reem. Listening to Prof. Selwa's experience with SEDAM, from your experience in health system transformation, how do such innovations link to the national transformation goals?
I just thoroughly enjoyed your remarks, Prof. Selwa. And I want to take your question, Fatemah, in doing a bit of a commentary, I guess, on this as a case for a solution that is designed to deliver better value. Well, first of all, there is a very clear vision in the solution where the target population that we are trying to serve has been very clear from the beginning. The other element of what we heard is that this solution is part of the care cycle. It's not like this solution that's out there, and as you nicely mentioned, that people don't need to go and get an appointment, they don't need to travel. It's part of the care cycle, particularly in primary care, which is the foundation and the grounding of our health sector transformation. And we heard a lot from you, Prof. Selwa, about the importance of learning and the importance of ensuring that we measure outcomes, and the results or the impact or the outcome is a key element of delivering better value. I'd like to say one thing about digital health. In general, when we speak about digital health, it's a key enabler and a key feature of modern health systems. It's the backbone of 21st century health systems. And when we speak about digital health, we speak about three things. Digital solutions, such as telehealth and other types of solutions, and including the example that we have at hand today, data, and the third one is artificial intelligence. And all three are exemplified in today's case. And digital health is an extension of the health workforce, and we know that we have a challenge in providing or having a workforce that is highly specialized and available to address the needs of our population. And digital health is a way to address this. And it's a way to address key challenges when it comes to equity. And we heard a lot about remote areas and where we have this solution available to people in remote areas with a centralized hub where we have an expert that can help improve and iterate the decision-making of the AI solution. It's a key and beautiful example of how, with innovation, we can solve for the needs of our populations as the rate of discovery and rate of also population growth occurs, and it's seamlessly integrated in our care system. I very much appreciate having such an innovative example in Saudi Arabia, and having Prof. Selwa as a national figure represent this and provide this, oversee it, and also be the voice and face for the solution in the global scene. And back to you, Fatemah, for the next part of our webinar.
Thank you, Dr. Reem, Prof. Selwa. This discussion has made it clear that a high-value health system is built through the synergy of visionary policy and practical innovation. To conclude, we have seen today that one of the enablers of high-value health system is the strategic integration and adoption of new technologies and digital solutions. The adoption of these digital solutions act as a lever to enable, as you said, Dr. Reem, to enable high-value health system, directly impacting population health and the quality of care. By supporting these proactive models, we are not only improving individuals' patient outcomes, but also ensuring a sustainable future for healthcare in the kingdom. Thank you to our audience. Stay tuned for our upcoming webinar, where our focus is to improve value in health and care to achieve better health system value. Have a great day. Thank you, Dr. Selwa. Thank you, Dr. Reem.
Thank you.
Thank you.